So this touches on some of my other videos, but there are lots of different sorts of premium intraocular lenses. I just want you to be cautious of the premium word because it makes it sound like if you throw money at something you get the best possible thing. And yes, there are plus sides to these lenses, but there are also minus sides to the lenses as well. The ordinary lens, which works very well for the majority of patients, used in NHS, we set people for distance, it's called a monofocal lens. But people can be left with astigmatism, which is a rugby ball shape of the cornea, and their intermediate and near vision can be compromised because the lens doesn't move, it doesn't change shape. There are premium lenses designed to give you distance and near and intermediate vision. Lots of different sorts. Multifocal lenses, bifocal lenses, extended depth of focus lenses, or premium monofocal lenses. Those are the main sort of categories which we have. They all work in different ways and they have different pluses and different minuses. So there are compromises. For example, the multifocal lenses split light energy off into 3 places typically. And so you have to reduce the light intensity to each of those places. And that can have implications. There are implications with glare and contrast sensitivity and light intensity. The bifocal lenses do something similar and they split light energy probably 60-40 or something like that. The premium monofocal lenses are probably the safest type of premium lens, but they don't give the depth of focus that the other ones intend to, but they have very few side effects, and it's something that I'm using more and more. You need an in-depth discussion with your surgeon about exactly what you want to achieve. Would it drive you crazy to wear reading spectacles? If you don't want to wear reading spectacles, are you prepared to put up with the compromises of these clever lenses? Your surgeons will have their own group of lenses that they use, and so it's important you ask them, what scope of lenses do you have and what would you recommend for me? But in the end, it's not our decision, it's your decision. We give you all the available information and you make an informed choice about your care and decide exactly what you want. So you discuss with your surgeon what sort of lens you need, and then hopefully they can achieve it for you using one of the premium lenses. Sometimes the premium lenses are not right for you and you have to accept that. And just because your neighbour had it and it was perfect for them doesn't mean that it'll be right for you. But this is the whole point of you coming and seeing a professional. We have fantastic surgeons in this country working privately and within the NHS. So they're trustworthy, and hopefully you can see somebody who will really explain things to you. And it's that interaction that's important actually, the communication skills. They're all very good surgeons, but sometimes the communication skills are important, so please feel free to ask questions and we will help you.